Hi everyone, welcome back to Let's Talk About It with Kelly. This is John, my husband John. He's the trichologist at our clinic, Freedom
Hello.
Clinic. Today's topic is going to be hormones and hair loss.
Wow.
Yes, it's a good one. First question, John, how big of a role do hormones actually play in hair loss?
Probably not as big a role as most people think. Now, that being said, if a person has a hormone imbalance, it's quite possible that it is affecting their hair. But a lot of people think when they get some gradual thinning, automatically it's something to do with a hormone imbalance. And actually, most of the time, it's not. That's the important point. So it's more often it's not to do with hormones. But if your hormones are imbalanced, there's a pretty high chance that it could be affecting your hair loss. But it takes a major imbalance to affect your hair.
Menopause?
Usually. Yes, we'll talk a little bit more about that. But certainly your hormones are changing drastically. But it points to something that's important.
Okay, great. Can your hair be the first sign that something is off hormonally?
It could be. Usually when we have hormonal issues that are causing hair loss, we have other symptoms from that hormone imbalance.
Right.
Okay. So, for example, if a young woman develops PCOS, polycystic ovary syndrome, where you get these cysts on your ovaries, it causes the ovaries to produce higher amounts of androgens. Okay.
Yep.
Androgens can affect hair loss and hair growth and the hair growth cycle. So in this case, you might have other symptoms. When you increase androgens, you not only get possible hair loss, you get oily scalp, you can get more acne, and you can have trouble losing weight. Your periods may become irregular. That's one of the most common indications of PCOS. So usually with a hormone imbalance, you'll have other symptoms aside from the hair loss.
Right. Okay, perfect. Thanks, John. We hear a lot of the DHT. What is it?
DHT is an androgen hormone. It's derived from testosterone. When a person gets hair loss related to DHT, we call that pattern hair loss. In men, it creates that pattern in the scalp where you get the bald crown.
Right.
Start receding here. You could end up going bald on top. Mm-hmm. In women, you'll generally get a thinning through the top of the scalp. Very few women will go bald. DHT hair loss can affect the entire scalp, but it's usually limited to some extent to this top area. It's most prevalent in the top area. It's important to understand that DHT, it being a major cause of hair loss, it doesn't mean that you have high DHT, and this is one of the most important things that people need to understand.
Okay.
It just means that your hair follicles are sensitive to DHT. So it doesn't matter how much you have.
Right.
Any presence, it can have a negative effect on your follicles when you have this predisposition to pattern hair loss, or what we call it androgenetic hair loss.
Okay, great. Thanks, John. Next question. How does hormonal hair loss show up differently in men versus women? You kind of talked about that.
That's a tough question.
Yeah.
I'm not sure why, and we do have to sort of tread lightly here, but definitely in women, we tend to have more hormonal issues, meaning women get more symptoms. Actually, women, it's not that they get more symptoms. It seems that women are more likely to get hormone imbalances than men are.
Right.
I do blood tests on a lot of people that come into the clinic. We very seldom get, hormonal issues in men, but we discover a lot in women, or women come in and they already have diagnosed hormonal conditions. We talked a little bit earlier about how common this is and how much hormone imbalances can affect hair loss. In men, it's very rare to see their hair loss, a telogen effluvium, only related to a hormone imbalance. I very seldom see it, but I see it much more often in women.
Okay, so as you age, men get low testosterone, some men. What would the percentage of that be?
I don't know what the percentage of men that get lower testosterone. I don't know what that is, but that would actually be beneficial to hair loss because the DHT comes from testosterone. So if you have lower amounts of testosterone, you're probably going to have less DHT. And that's actually going to be beneficial. If you have higher levels of testosterone, then that can make hair loss worse. Again, if you're sensitive to this DHT hormone, if your scalp follicles are not sensitive to it, then it may not matter whether your testosterone is high or low.
Very interesting. That's a great topic. Next question. Why do women often notice thinning all over while men see receding and balding patterns?
That's, again, another really difficult question, and it's changing. It seems to be changing a lot, meaning we're seeing a lot more men with diffuse hair loss throughout the scalp, and we even have new terms. We have this new term called DUPA, diffuse unpatterned alopecia, which is a form of androgenetic alopecia, or pattern hair loss, where there is no pattern, where it's just affecting the scalp all over, but it's behaving like pattern hair loss.
So it's hard to diagnose that.
It can be difficult to diagnose, but there's specific characteristics when we do the microscopic analysis. Now, it's more common in women. Why? We don't really know. Usually more of a woman's scalp is sensitive to these hormones than in men. So men, we get a real strong distinction between hair loss and no hair loss. Whereas women, it's a general thinning, and it gets maybe less and less as we get down the back of the scalp and the sides. But the important thing here is that, the pattern is very different in the severity of the hair loss. We don't really know why that happens.
Well, that's very interesting.
Yeah.
Next question. How do hormones during pregnancy and postpartum affect hair?
Another good question, and there's a lot of misunderstanding around here. And this is a really good question because it tells us something about the person. So if a person has postpartum hair loss, it does mean that their follicles are sensitive to the androgen hormones, because what's happening? Her body produces a much, much higher amounts of estrogen. And when this happens, it actually protects the hair, because with these really high levels of estrogen in the body, it tends to dominate the androgens more, and they have less of an effect on the hair. So a lot of women will see increased hair growth, of their scalp hair, thicker hair while they're pregnant, but then they'll have their child and suddenly they'll undergo a significant hair shedding.
Right.
Now, often the hair will grow back quite normally, but often it won't. If it grows back normally, then the person's sensitivity to the DHT might not be so severe. But oftentimes what happens is this pregnancy will be the trigger, or will be the onset of the androgenetic hair loss, where the hair, when it regrows, it comes in thinner and finer. So some women don't recover from that post-pregnancy hair shed.
Because they've already
100%.
had that genetics in it.
They have that genetic predisposition to androgenetic hair loss. Some women who don't have this sensitivity might see a difference in their hair, but it's definitely going to be much more severe if you have a sensitivity to androgens going in.
Okay, great. What happens during menopause, and why do so many women notice thinning?
It is much more common in postmenopausal women to experience androgenetic hair loss. And again, the reason is related to hormones. So when you enter menopause, what's happening is your estrogen levels are dropping again. So just like we talked about how the estrogen levels drop after when you give birth, when you enter menopause, your estrogen levels are dropping. This makes your hair more open to being attacked by this DHT, this androgen hormone.
Yeah.
Okay. Again, you have to have this predisposition to the androgen sensitive, follicles. That has to be part of your genetics. The other thing is, with hair loss in men and women, as you age, you have a higher possibility of experiencing androgenetic hair loss. So we get into our 50s and 60s and 70s, it's more likely that we're going to experience some hair loss, and the numbers are high up here. I mean, more than 50% of people over the age of 60 will have some kind of hair loss, even over 50, age of 50.
Yeah.
When women get into menopause, then we've got two things affecting. We've got aging, and then we've got, this reduction of estrogen, which can, leave the follicles open to more effect from the androgen. So yes, when we get postmenopausal, women have a higher chance of getting increased androgenetic hair loss.
Wow. Okay. Thanks, John. Next question. I think we kind of answered it. You kind of answered it for me, but I'm going to ask it again. Can testosterone levels in men speed up hair loss?
So yeah, and again, you have to be susceptible to this androgenetic hair loss because we talked about how DHT comes from testosterone. So men who take testosterone and have hair loss are at risk of worsening it.
Wow.
Now, maybe if you have low testosterone and you're bringing it into normal levels, it doesn't increase it because your body is using up that testosterone for other purposes. The testosterone that affects your hair that, is able to transition into this DHT is what we call free testosterone. So it's floating in the body waiting to be used for something. So it can be used to be transformed into DHT, and this is what affects your hair. But if it's being used for other processes, then you might not have a lot of free testosterone. So there's a difference between total and free testosterone.
Interesting.
And high, it's the free testosterone. If it gets high and out of whack, then that could cause a problem.
Interesting. Okay, next question. Can thyroid issues or other hormonal imbalances cause hair loss?
So a good point to remember
Thyroid is big.
It is big, and we have specific types of hair loss that occur sometimes. For example, often the first sign of hair loss due to a thyroid imbalance is the outside of the eyebrows thinning out in here.
So just the outside, not the whole eyebrow?
Yeah, just the outside half.
Okay, so that's...
So if you notice that outside half starting to thin, then you might want to get your thyroid levels checked. But getting back to the initial question,
yeah, can thyroid issues
and other hormonal imbalances. So it's important to remember that any hormone imbalance can cause a hair shed. Okay, it can trigger a telogen effluvium. If it's a long-term untreated hormonal imbalance, it could cause a chronic telogen effluvium, meaning a chronic shedding of hair. Often when this happens, we don't so much see a reduction in the thickness of the shafts because they're not necessarily thinning, they're just shedding and regrowing.
Right.
But we'll often see shorter hair lengths, higher rates of shedding constant. This can happen technically with any hormone imbalance. Any hormone imbalance is a form of stress on the body. Stress can cause hair loss. So it is important to make sure all your hormones are, in balance. And we check some of these because the common ones. There are a lot of hormone imbalances that probably won't. It's possible they can, but it's more unlikely. So again, like you mentioned, thyroid. We look at very closely. We look at the androgens, we look at the hormones produced by the ovaries, trying to diagnose PCOS and stuff like that. So
this is blood work that you...
Yeah, that we do
a requisition for?
Yeah, standard blood screening that we do with most people when they come in, men and women.
Right. Okay, great. Next question. Do birth control or hormone therapies impact hair growth or shedding?
Yeah, they can. And in fact, we sometimes use birth control to treat pattern hair loss in women.
Wow.
So, and again, because birth control contains estrogen and usually a progestin of some kind of synthetic progestin hormone. Now, the important thing about this is there's specific progestins that seem to work better than others in preventing or reducing androgenetic hair loss. Okay, and again, what this medication, what a birth control pill is doing is it's protecting the hair follicles from the DHT. So yes, there are other hormone therapies. So one of them is spironolactone. It's a diuretic with anti-androgen effects. Doctors often prescribe this for PCOS symptoms. It can help with hair loss, not in a lot of cases. 30 to 50% of people will see an improvement once we get to a certain dosage. But yeah, there's some hormone therapies that can help with hair loss for sure. And we sometimes use these to treat hair loss.
Interesting. Great. Okay, just a couple more questions about this, John.
Okay.
Are people blaming hormones too much or not enough when it comes to hair loss?
I'd probably say too much.
Yeah.
But that being said, we still want to make sure we screen everybody for all the relevant hormones. You know, when somebody comes in with a hair loss issue. Absolutely.
Okay. Can balancing hormones actually reverse hair loss or just slow it down?
Okay, so balancing hormones will reverse hair loss
Okay.
if the imbalance is the main cause,
Right.
right?
So you don't
if
really
we have
know.
yeah, that's right. So, but, you know, we have to do the blood test. If we find a hormone imbalance, we fix it, then the hair can possibly return. Now, if a person has a sensitivity to DHT and androgenetic hair loss predisposition, even though we fixed it, the hormone problem, maybe the hair loss continues because the hairs have already thinned. And yeah, so
So there's other things they can do to help that.
yeah, we can treat that. The important thing is that the hormone imbalance isn't always on its own when it's causing the hair loss. If it's the only cause, then we fix the hormone imbalance, we fix the hair loss.
Okay, that's a good answer. Last question, John. What does proper testing and diagnosis look like when hormones are suspected?
Mainly blood work, and case history is very important. So we want to know, what other symptoms the person has. We want to know what medications they've tried and for how long they've been on them, to do with their hormones. We want to know, so all their history, their health history, and past experiences, have they had children? All these things are all going to help us with the diagnosis because these are things that affect their hormones. So if we sort of track, we can do even a graph where we track when the hair shedding started or when the appearance of thinning came on or when the hair shedding stopped, and then what's happened with the person's medications, their health history, and all these things on this timeline. This can certainly help in the diagnosis. It can tell us, are we dealing with a telogen effluvium? Are we dealing with a genetic hair loss? Are we dealing with something else? So certainly we need to look at all of the health history, but then of course we need to run some blood tests on the suspected hormonal issues. So basically it's a case history, and then we'll run the hormone blood test. But even also, our microscopic analysis can help tell us if it's impossible, or it can rule it out too. So if we get a person comes in, say a woman comes in, and she's got some thinning on the top of the scalp.
Right.
She's saying, "Oh, do I have a thyroid problem?" I can look at the scalp, I can analyze the hair loss, and I may have obvious indicators like the sides and back of her hair are not affected at all. Her eyebrows are unaffected. She has some significant miniaturization of hair shafts in the crown and top area of the scalp. The hairline seems to be unaffected. It's nice and thick. So we've got this little pattern of thinning right through here, not affecting anywhere else. Then it's highly unlikely that that's a hormonal hair loss. It's an androgenetic hair loss, and we may not need to look too deeply. Now, we still will run blood tests if they haven't been done.
Just to rule it out, for sure.
To rule it out, but most likely that's not hormonal. So we can tell sometimes without doing any really deep tests, although we usually run them anyway just to be sure.
Yeah, thorough. Okay, that's great, John, on this topic. Thank you very much. And bye, everybody. We'll see you next time.
Okay, thank you.
Bye.
Bye-bye.